How is HIV transmitted? In this video we are going to explain, how do you get AIDS? How do AIDS happen? How is HIV transmitted? What are the common HIV spreading factors? What are the rare cases when HIV may spread, and what are the factors when HIV is not transmitted? HIV is such a fatal virus that infects people by getting inside their blood cells. In order to avoid getting HIV, you must prevent the blood, semen, vaginal fluids, or breast milk of someone who is infected with HIV. To become infected with HIV, infected blood, semen or vaginal secretions must enter your body. This can happen in several ways: by having sex. You may become infected if you have developed close relationship with an infected partner whose blood, semen or vaginal secretions enter your body. Only certain body fluids, blood, semen, pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk from a person who has HIV can transmit HIV. These fluids must come in contact with a mucous membrane or damaged tissue, or be directly injected into the bloodstream for transmission to occur. HIV is spread mainly by developing close relationship with someone who has HIV without using a condom or taking medicines to prevent or treat HIV. Sharing needles or syringes, rinse water, or other equipment used to prepare drugs for injection with someone who has HIV. HIV can live in a used needle up to 42 days depending on temperature and other factors. Less commonly, HIV may be spread from mother to child during pregnancy, birth, or breastfeeding. Although the risk can be high if the mother is living with HIV and not taking medicine. Recommendations to test all pregnant women for HIV and start HIV treatment immediately have lowered the number of babies who are born with HIV. HIV may also be spread by being stuck with an HIV-contaminated needle or other sharp object. This is a risk mainly for healthcare workers. In extremely rare cases, HIV can be transmitted by receiving blood transfusions, blood products, or any organ transplants that are contaminated with HIV. This was more common in the early years of HIV, but now the risk is extremely small because of rigorous testing of the U.S. blood supply and donated organs and tissues. Eating food that has been pre-chewed by an HIV-infected person. The contamination occurs when infected blood from a caregiver's mouth mixes with food while chewing. The only known cases are among infants. Being bitten by a person with HIV. Each of the very small number of documented cases has involved severe trauma with extensive tissue damage and the presence of blood. There is no risk of transmission if the skin is not broken. Contact between broken skin, wounds, or mucous membranes and HIV-infected blood or blood-contaminated body fluids. HIV is not transmitted by hugging, shaking hands, sharing toilets, sharing dishes, or sitting closely with someone who is HIV positive. Through saliva, tears, or sweat that is not mixed with the blood of an HIV positive person. By mosquitoes, ticks or other blood-sucking insects. And through the air. As I mentioned earlier, only certain body fluids like blood, semen, pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk from an HIV-infected person can transmit HIV. Most commonly, people get or transmit HIV through sexual behaviors and needle or syringe use. Babies can also get HIV from an HIV-positive mother during pregnancy, birth, or breastfeeding. Thanks for watching. Please give your feedback and don't forget to subscribe to Health Experts.